Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Hey y'all, it's Gail Tralco, and today I've got my wonderful friends back again, Christina Nelson, Holly Riddle, and our special guest, Dr. Kaloostian, who's a neurosurgeon. Hey, Dr. Kaloostian.
Hey, it's nice to be here. Thank you all for having me.
Oh, Absolutely. You're welcome. So we want to know, I'm a nurse. I'm a certified oncology nurse, and I've been a nurse for 43 years. So I know how important doctor-patient relationships are. So we were so excited to have you be with us today.
Well, the pleasure's all mine. I think this is a very important topic, and let's get to it. Let's talk about some of the main issues that are important in patient-doctor communication.
Well, Holly, you want to ask the first question?
Go for it, Holly. You got it.
Oh, I'm sorry. My sound just went out. I'm like, huh?
It's that Botox you were thinking about.
Right?
Now, what is this? I feel a little picked on. I am the youngest. I'm men in my family. Sorry. Oh my gosh, this is a great way to start. Okay, well, I've been with, I guess maybe more of just a statement. I recently had a full hysterectomy, and to be honest, it's the first major surgery I have in my life. I'm 55, and it was because of my doctors, the relationships, the kindness, the empathy. I mean, I literally was in tears so many times. Because of the care that I felt, and I actually made rings for every one of them that wow. took care of me. But it was because of this exact topic that I said yes. I had a very large fibroid. It was causing intense pain, and but I was really scared, really scared, and. Because of how my doctor treated me, she even would put her hand on my leg, and just the kindness, and so this show, I was like, wow, how timely, because from my regular doctor, Dr. K, I call her, she just, you could just feel how much she cares about you. She's the one that pushed and then turned me on to another doctor that said, listen, I'm going to take care of you. I'm not going to let anything happen to you.
Right.
And it was, so what you're doing is just so important. On so many things that you're doing. I was on your website and I was like, holy smokes, you're phenomenal. Wow. I was like, okay, I want to be on this show for sure.
You're making me blush. Come on.
Oh no. I mean, that's fascinating to me. Absolutely fascinating.
And we don't know the value of this doctor-patient relationship until we are sick. And that's kind of sad, but it's the truth. Until you're in that position of laying horizontal on a hospital bed or on the operating room table with 1,000 people coming in and out of your room in a cold hospital room, you can't possibly understand the value of this doctor-patient relationship. It's just hard to grasp it, and that's normal because you just don't understand it until you're in that situation. And the value, just as you mentioned, and I'm sure many others listening have felt this, the value of having a honest, ethical, healthy relationship with your physician and other team members is so vital to the healing capacity of us as human beings. And people have studied this and done a lot of different scientific work, but yet some others say, well, it's kind of like not something that's very provable. It's very kind of mentally, spiritually the case, but it's not something scientifically validated. But it's been validated. It's very clear that that for our psyche, we feel more comfortable being treated by people or by the doctor that treats us well, that understands who we are, understands what we're going through, is empathetic. We feel more comfortable with that. And because of that, we are able to psychologically be more clear-minded, no stress, no doubts, no negative energy during that particular time of your life, that you need to be completely positive and open. So I think that is very, very valuable stuff. And my books, touch on quite a bit of those topics.
Well, I think what you're saying is exactly what I do in my life is I help people focus on love being their intention, and that's actually the ring. LIMI, love is my intention. Oh. And that's why I gave the rings to all of the nurses, my surgeon, my doctors, because I told her, this is what you do for people. You give them love and hope, and it's a game changer. Huge. And so I maybe it's not. I do believe it's scientific. I do believe that when you feel love, it's healing. It's the opposite of stress. Stress. I was stressed out yesterday. My stomach started hurting. I had a headache. You name it. That I know it's dramatic. The whole stress kills. Well, it can. I mean, it can really wear you down. And love is just the opposite. Love is a game changer. And so everything that I create is around helping people shift their thoughts into positive ones, into empathetic ones. Even the fragrance I created, because it's in our sense of smells connects to the limbic system, which is memory, feelings, emotions, as you know.
Yeah.
And so the intention behind the fragrance is to look into the eyes of people with kindness and wonder and non-judgment. Right. Let's start with yourself when you're putting it on, and look at yourself. So yes, we more than anywhere, I think with our doctors, heck yeah, if we can't feel love and caring from our doctors, run. Run. I had an appointment with a cardiologist just for a regular checkup, and it was a gentleman, probably 60 years old. And as I'm sitting on the table, he's telling me what blah, blah, blah about the EKG. And I said to him, and he's barely looking at me. And he had started off, it was chilly. And I said, you have a mark right here and it's raised. You really should get that checked. And I meant it. And I honestly meant it, because it looked like, and he looked at me like, are you some kind of hippie? And because he wasn't very friendly at all. And then it was just hilarious. I mean, I think, so what you're saying, if you're with a doctor that's not giving you the feels that you need and the compassion, first of all, I think don't change giving it back. Continue being loving but maybe look for someone else, because it's everything to me. Yeah. It brings the joy in my life. So,
and I think it's important, and I think doctors, as we go through our medical school training and me going through neurosurgical training for, a long time, many years. We don't get these focus classes on how to talk to someone. Like we're good at opening the skull, going into the brain and opening up the spinal cord, using the microscope and all of that. But like, okay, so then we get out into practice and we're like, go. And so we're dealing with patients, and yet we don't really know how to communicate with them appropriately. Imagine, you guys have heard these stories where you're sitting there and the doctor doesn't even look at you in the eye. You just mentioned it yourself now, but that happens all the time.
That's right.
And there's all these constraints. Doctors have to see like 40 patients in a day.
Yeah.
A lot of these hospital chains put this whole list of patients for them for the day, and it's hard. There needs to be teaching for this. This needs to be implemented appropriately so that patients get treated well. How are you as a patient going to feel comfortable telling this doctor or nurse everything that's bothering you? You're probably going to withhold information that's maybe vital just because you don't have that safety, or you don't feel comfortable communicating all of that.
A lot of times as a nurse, I can get a patient to tell me something before the doctor walks in the room. If I'm visiting as a therapist, and all the patients that I deal with are end-stage disease. They have failed their last chemo regimen, so they're not even on palliative care anymore. They're getting ready to go to hospice.
Wow.
So that's, it's a really critical time for families, and they'll tell a nurse many times, unless that doctor's got a good bedside manner, they'll tell that nurse everything that doctor needs to know before he walks in the room. The nurse, I'm taking notes the whole time. And, the nurse at the hospital is too. So when he walks in the room, we kind of regurgitate that conversation, Dr. Kaloostian, and the patient and the family are there. And then the doc has a place to start. They have a starting point when they come in the room.
Right.
Yeah. And, what I usually try and teach my students and colleagues, it's a few things. The most important things to remember when you're talking to a patient, sit down.
Yes.
Just sit in the chair. I'm not saying sit on the floor, but sit in the chair. Sit down. Believe it or not, just sitting down will make you as the patient feel a lot more comfortable. Secondly, the power of touch, touching the patient, examining them, touching where it may hurt. There's this energy that gets communicated between this doctor that people respect and the patient. The patients feel more comfortable. There's that energy transfer from the doctor to the patient. The patient feels like this doctor is trying to figure out what's going on and trying to help me. And I like that. And then, like you had just mentioned, repeating what the patient tells me. So when the patients tell me something, I usually like to summarize it really quickly in a sentence or two. Okay, so it hurts here, here, and here, and it's been going on for this so many days. And you tried therapy, you tried chiropractic, it hasn't worked. Is that correct? So that shows the patient that I'm listening. I'm not just dozing off. I'm listening. I'm listening to what you're telling me. I understand what you're telling me. So let's move on to treatment.
What would you say to patients now? There's a lot of vaccine hesitancy, and that's a big topic of discussion in clinic with just about every patient or family member that walks in with a family. And some patients can be vaccinated for, and other patients have, other medical underlying conditions and they cannot be administered the COVID vaccine. So how are you handling those discussions with patients?
Well, the main thing is be respectful of the patient's feelings. Every patient is different, okay? And everyone comes from a different background. We have a nanny who's a Seventh-day Adventist, and the greatest woman, nicest woman, but they don't believe in vaccines, at least her specific type of religion.
Right.
They just don't believe in it, and that's okay. Everyone has to do things their own way, and maybe over time, as more and more data comes out, people can read the literature, educate themselves on it, and then change their mind, and that's fine too. No one should be forced to do something that they don't feel comfortable doing in any way in life, no matter what it is. So, but I think I always tell them, look, these are the risks, these are the benefits. You could get sick from it. I've had patients, I have a mother-in-law who got sick from it. not great. It's terrible. They're better now, but it's not fun being sick. So, but you can also have positive rewards from this vaccine. Obviously, you may get sick, but it may not be the most terrible version of the flu that you could get. So,
Right.
and you just let the patients decide over time. The patients will make their decision.
Right. Absolutely.
Well, as a
I have
neurosurgeon, you're dealing with a lot. Do you do brain as well?
I do, brain and spine.
Yeah. So those are tough medical cases.
That's why I had to write about it, because it was just so many cases that I was seeing: gunshot wounds to the head,
Yeah.
stabs to the spinal cord. I mean, just you wouldn't believe it. So I had to kind of have a catharsis. So I put it into my books because I needed to get it off my mind, and I wanted to showcase my patients how brave, how amazing they are to go through these very difficult surgeries, and that's not easy to do.
Wow.
I have to interject, and also when we're talking about bedside manners with patients, it also goes for their staff. My wife does CAT scans and MRIs at the hospital, and doctors come in and they are just, not all, but some are rude and horrible and cuss and just mad and throw things. And it's really bad. I hope they don't treat their patients that way, but it's not only the patients. They need to be a little bit more bedside mannered, so to speak, with their staff.
Yeah, and absolutely. It's a team effort. Everyone is valuable in this healthcare profession.
Right.
You're treating patients in their greatest time of need. When you're sick, you will understand that. When you're sick, you'll give anything to not be sick. Anything. I swear. I'm the same way. Others, you'll pay any amount of money. You'll give all your money, give all your possessions to be well again. And that is just the truth. And so everyone is valuable, from the janitors to the surgeons. Everyone is valuable.
Absolutely. And should be treated accordingly.
When in your career as a neurosurgeon, Dr. Kaloostian, did you realize how important the bedside manner was? Because I've worked with, medical students all the way through the chief surgical fellow, and it's a learning process during these 12 years of physician education you're going through to get your specialty.
Yeah, no, that's a great point. I grew up in a family of physicians, so my parents are physicians, and so I kind of was brought up just to do the right thing. I was always, told to always do the right thing for the patient, be respectful of the patient. So I kind of had that in me, and I think just progressing and seeing so much terrible healthcare out there by colleagues and others, that also is a learning point. It's sometimes good to see the bad so that you can know how not to be. You could be told, do this, do that, do the right things, but it's also good sometimes to see how not to be in life, and then you're like, I don't want to be like that. That's not right. I don't want to treat anyone like that. And so I think learned a lot just by seeing both of those ends of the paradigm.
I think things are a lot better with bedside manner, just having been in nursing as long as I have and working, at major medical centers. I was in the OR when I was probably 25 as an OR nurse, and I saw a surgeon get mad at the scrub nurse and throw the scalpel at her across the patient, and he nicked her in the chest. Well, she goes to human resources at this hospital to file a complaint, and they told her she needed to resign. He brought too much revenue into that hospital.
Wow.
This would have been this was 40 years ago. Yes.
Oh my gosh.
So things are much better in the hospital setting now than they were 40 years ago.
What?
Yeah, that is remarkable. I've heard those stories too. I have never seen.
I was there. And I wasn't a scrub nurse. I'm not a scrub nurse.
Believe it or not, I've had a bloody OR towel thrown at me when I was in my training by someone. They're going to remain nameless.
Yeah.
But not very good. Not very professional. But these are all learning experiences. We go through life, we learn.
I can imagine the stress that you go through, and doctors and nurses. So I get it that you want to throw scalpels or whatever, but you really have to refrain yourself. You have to be professional.
Well, it's a good
on.
idea too.
My 2-year-old was throwing Legos yesterday. It's kind of like, as you get older, you kind of think that's kind of going to end. I would hope at some point. I mean, that kind of should, as you get older, you should kind of mellow out maybe and kind of become wiser, right? Know how to handle stress a little bit better, hopefully.
I think physicians are under a great deal of stress. You mentioned this with the caseload and the expectations of hospitals today for how many patients they have to see in a clinic. Oncologists can see, the surgeon I worked for might see, he had melanoma clinic one day a week. He might see 100 patients from 7 a.m. to 6 p.m.
Wow.
With the medical team. And this was at Duke University.
Wow.
I worked at a major cancer center.
Wow.
Yes.
Oh my
And
God.
he spent time with every one of those patients, didn't take a break, didn't eat lunch. And he was dedicated to making sure that they had he was just there. He was present. He rounded at 6 o'clock in the morning because I rounded with him every day for the inpatient part. So things are better today. I don't think the oncologists have as heavy a workload, or the surgeons, they don't see 100 patients in a day, but they probably see up to 30 or 40 on a busy day.
Yeah, no, absolutely. I think time management is critical in medicine. Once again, you're not taught time management either, really. I mean, other than how you study and prepare for exams, you kind of have to manage your time that way. But beyond that, you don't have a course. How do you manage your time with 20 patients and then having to type up notes? Yes. And notes have to be clear. You can't make a mistake because you could be sued because you make a mistake, or you have the wrong patient, you type the wrong note for the wrong patient. Bad things happen. So you have to manage time appropriately and yet be exact at the same time. That's not easy.
No, it's a lot of stress on the doctors in the hospitals today. Yeah. And I think patients, insurance is another issue, Medicare, Medicaid. They're worried about when you're diagnosed with a medical condition, how are you going to pay for the treatment? Doesn't matter what kind of insurance you've got. If you got cancer, most of the policies max out at $1 million. Most health insurance policies for treatments. So do you hear a lot of that with these neurosurgical cases? Patients talking about financial stress.
Yeah, and I don't know if you guys caught that article that came out recently. It was a huge deal all over the news. What's the most common cause of debt and bankruptcy right now in the world?
Medical bills.
It's medical bills, 100%. Well studied.
Right.
It is. That is the answer. That is what is happening. And I see a lot of the bills from hospitals and other places, other colleagues. I see them a lot. I review them often. And it is an expensive proposition. It's an expensive business, and I mean, the hospital fees, let's say for a night in an ICU, it's like $20,000 at least for one night in an ICU, and then you tack on, if you have a surgery, you have multiple nights in the hospital. I mean, forget it, so, I mean, for one hospital stay, it could be $300,000 or more. And without insurance, what do? How do you respond to that? You have to start selling your possessions. You have, and by the way, I mean, those bills, they're going to follow you wherever you go. They're not just going to magically disappear one day. It would be nice to have some sort of system where you have people that are very fortunate to be very wealthy in society and have them help. I think that would be so beneficial to the world. There's so many, fortunate people that have, really succeeded, in making money. And they've kind of started ventures where money is kind of easily made now. Mm-hmm. And it's almost excessive. It really is excessive in some cases. And I think there should be a proposition, discussion with Congress about that kind of help. I think that would help so many people. You wouldn't even understand. It would be so beneficial for people, even just families that are, that have mom and pop shops that just can't afford to pay their own medical bills for themselves, for their kids. So they end up, hurting themselves. Bad things end up happening, unfortunately. But these could be people in society who could, find the cure for cancer. And we're losing out on that because of these excessive bills that just cannot be paid.
And before
That's all
Medicaid will
heartbreaking.
kick in, and before emergency Medicaid in any state kicks in for patients with these huge medical bills, and this is anywhere in the United States, those patients have to sell their home, and that money for the home sale is used to pay against the medical bills. If they've got a car that's of any value, they need to sell that vehicle. And because I have a medical bill 911 business, and that's what we do, is negotiate medical bills on behalf of patients.
Oh.
And it is a cruel world for medical bills because people want the money. And there's probably 20 to 30% errors in any medical bill that you get, especially in inpatient hospitalization. Those are coding errors because most of the coding is outsourced to third-party vendors outside the U.S.
Yeah.
Because, they're paying $3 an hour for personnel to do billing and coding. And, it's just $3 an hour versus paying somebody in the U.S. 15 or 20.
Yeah.
And the end result is we're in this vicious cycle where the patient is caught in the middle between an insurance company, somebody threatening to take them to court. And if you qualify to go on emergency Medicaid, you have to get rid of everything you have. So where are you going to live and how are you going to drive to work?
And imagine the stress. I mean,
Yes.
you're recovering. You have, let's say, a wound on your head or on your spine, screws and rods in your body. You're going home and you're worried, how am I going to pay for this? Oh my God.
Yeah.
And you're stressing out, you have kids,
Right.
your wife, you have others, and, imagine that. That cannot be good for your recovery at all.
And 5 days probably after that patient's home, the medical bills begin to come in to the mailbox.
Yeah.
And people have that medical illness. And I tell everybody there's a certain level of depression and grief and anxiety that go along with any serious medical illness.
Yeah.
You may have never said before, I feel depressed, but there's a certain level, there's a loss. You've gone through a trauma. And I think when people acknowledge that, you've got to reach out and get a helping hand.
So true.
Right.
And each hospital may have one patient advocate on staff, and they are not going to be that person to go to medical billing to negotiate that bill for you. Not at all.
No.
Well, Gail, you looked into a friend of mine. They have a little Italian restaurant here, an older couple, and their son had a catastrophic event. He had a brain aneurysm, and they don't have insurance. They're struggling in this little restaurant, and his bill was, I don't remember, Gail, $150,000, $200,000.
Oh, easy, yeah.
And they there's no way they can afford that bill. So it was not just a catastrophic illness for their son, but it was catastrophic for the whole family because they can't pay the bill. Yeah. And so they're being hounded every single day with phone calls, inundated, and a tree worth of bills every day in the mailbox. And it's unbelievable. And they're not doing it to be malice or mean or they can't afford it.
Yeah.
So
and the debt collectors are threatening when they call. They're communicating in a threatening manner to patients.
They do.
When they're calling the patients at this point in time. And I hope somebody in Washington is listening to the show today. We have a large pharma audience. And so I hope somebody's listening. All this surprise medical billing legislation that's being passed is not in effect yet. It doesn't kick in until 2022. And you know what? Should somebody commit suicide over a $250,000 medical bill? Absolutely not. There's got to be some money somewhere in the United States to pay it. So the government needs to find out where it is and use it.
Right. It's funny you said that because this family, the mother is so distraught over this. It's made her really ill. And she's been to the point where I give up, and depression is set in. And it's because of that.
And these situations are one of those things like we talked about earlier where you don't know how it feels until you're in that situation where you have these bills of $300,000 to pay and you just can't pay it. If you can't really know how that feels when you are a billionaire or multimillionaire. You won't understand it, because it's just not something that's as devastating to you, versus others that barely make ends meet, and they're humans like all of us, and they have the same problems like we all do. So they need help. We need to help one another in this world. It's sad because sometimes, and there are good people that help others, but there's a lot that I think we can improve on in terms of helping those that are less fortunate, that need the help. If we don't help each other, what are we as humans? What are we doing here? What are we doing in this
inexcusable.
experiment?
It's absolutely inexcusable. It's actually, just yesterday, I drove by a homeless man, elderly, with his dog on his knees. His sign said, "Help if you wish." And I'm getting choked up. I literally am driving and I'm like crying because I couldn't stop because of all this traffic. And I'm thinking, how do we do this?
Yeah.
How do we do this? Allow this? Yeah. It's and I thought, well, just what you mentioned, the billionaires that we have in this country. What the hell? What is going on?
Yeah.
I mean, I can't look at them the same as any, because I know that they could help. They could actually help these people.
Yeah.
I think we're figuring out ways to go to Mars. Get it going into the. But yet we have people sitting on the side of the road. We have people selling everything that they own just to pay a hospital bill because we can't figure out insurance. Bullshit.
That's right.
This infuriates me. Just yesterday, and it's for me, I cry every day over someone that I see that is hurting, because I don't understand how, as a society, we have gotten this low, and how long have we been here?
We've got nonprofit hospitals in the United States sitting on $23 billion that they want to use to build a new building. This is one in Atlanta I'm talking about that's under investigation. Sitting on $23 billion. They want to build a new building instead of paying children's medical bills for families in need. Yeah. This is in the media. It's in the media in Georgia. Who's going to make them stop? How many buildings do you need? How many do you need? For real. We've got Emory University in Atlanta. If you don't have it, put them in an ambulance and send them up to Emory to get it done. It's a phenomenal institution.
Yeah, the issue is that with more and more money becomes a desire to have more and more money. And there's not going to be an end to that. There is no limit to that. And it's almost a little bit like a childish instinct. And we all kind of, we kind of like more. That's how we are as humans. But we have to understand that what you could do with that amount of money for people that are in need is so much greater than just the benefit you'll get from gaining more money. That benefit of helping lives, literally helping people's lives that are in such great need, is a feeling that transcends any other feeling. I kind of describe it like when I'm doing a surgery, I'm nervous, I'm anxious, I'm excited, all these emotions. I do the surgery, patient does really well. That high that I feel is like no other high I've ever had. It's just such a great feeling. And nothing can beat that feeling. That is what I think we all could do. We all can help and chip in. The really wealthy, the less wealthy, we could all help one another out and just work with one another. We're all in this experiment of life together for a short period of time. It's super quick. It comes and goes very, very quickly. We're all going to get sick. That's just how it is in life.
Yep.
And I think we need to just work together, help each other out. People are struggling and they need help.
Dr. Kaloostian, are you a physician that will call an insurance company back on a patient's behalf to justify a charge?
Absolutely.
Do you know how hard it is for me to get a doctor to call an insurance company?
Oh yeah, no, I do. We discuss those. They're called peer-to-peer calls, and we often discuss, getting cases approved for patients, etc. So yes, I do that.
Well, thank you for doing that, because do you know how many doctors don't do that?
No,
and it's because they're being pushed by hospital administration to see more patients in a day, and they can't take. You may be on an insurance company call for 45 minutes. They can see if they're spending 15 minutes with a patient in an exam room, That's 3 patients that they could see in 45 minutes.
Wow. Wow.
So this is going on in hospitals in the U.S.
So there's inefficiencies,
Yes.
There's a lot of inefficiency in medicine, even though we're 2021 and the United States has the greatest healthcare in the world, because we do, there's still inefficiencies. And imagine other countries. I mean, if we're talking about all these inefficiencies here, imagine what's going on elsewhere. I mean, come on,
I don't know. It's pretty bad here.
I know, it's bad. I got to interject really quickly a little story that, the little Italian family, and they're elderly, and they're running this restaurant since 1972, I think, or something. But they're struggling. And COVID really struggled them, and that's when he got sick. She sees to it that this clinic that he goes to for his checkups and whatever, she sends him lunches. Italian food, and it's the cutest little thing, because that they believe giving food kind of compensates because they don't have the money, and so that's their culture. Feed them, get them fat and sassy and happy. That's what Italians love to do. And so a bill collector called, and she said to the bill collector, "Well, I don't have the money right now, but I do send them lunches, and from my restaurant." And you know what he told her? You can send them lunches from your restaurant, then why can't you send them money?
Are you kidding?
How rude was that? No, she cried. She called to tell me about it because she's a good friend of mine. And it was so sad that they said that, because they want their money so bad, and she thought, well, me compensating in some way with the food, because they have to have the Italian food anyway at the restaurant. So,
and this brings up kind of cultural diversity,
Yes.
Right.
Which is a whole different issue, in medical care. I mean, it's so important, respecting different cultures, different religions, different races, different genders even. I mean, all of these, need to be appreciated, and every patient's so unique in that way.
Right. And they're Sicilian, and that's their culture. If you don't have cash, you give them a chicken, I mean, that's what they did. And so people kind of think maybe that would work here, but it doesn't work that way, and they're really rude to her. But she will continue to feed this clinic every month. She'll have to make sure that they get a lunch.
That's
so
beautiful.
That's just how she is. Yeah,
I think it is too, Chris. Yeah.
Mm-hmm. Yeah.
Dr. Kaloostian, what do you do when you have an insurance company deny something that you're asking for a patient, like an extended hospitalization? What if you need to add 3 days to their stay for their recovery and the hospitalist says no?
Well, so a couple of things. One thing is make sure that you, as the surgeon and doctor, are documenting appropriately. That is key. Believe it or not, if you're documenting appropriately, most of the time it will get approved. And what I mean by that is, let's say I do a spinal surgery, and let's say there's some issue after surgery. They're not able to ambulate, or they have some weakness of the leg, which is impairing their ability to walk. Well, one of the things for discharge that all the insurances have is they need to be able to safely ambulate, obviously, and eat and go to the bathroom and all those things. But all these are important. So if you document that they're not able to ambulate safely, and physical therapy notes that as well, that will be approved as long as that is documented. And documentation often is not very good in medicine in different hospitals. It depends on the hospital, but in some cases it's not very good. So when I review for these things as well, I always look for that. But on the other end of things, if things are unfairly denied, and when there's appropriate documentation, we do these peer-to-peer calls. So I call someone from the insurance company, usually like a third party within the insurance company, who's usually a doctor in that field. I talk to them. We have a discussion, and I try to convey to them why this patient needs to stay in the hospital longer, or why this patient needs this procedure. And it needs to make sense. And I need to convey that to them in an accurate, appropriate, cohesive manner. And if that happens, that will usually do the trick.
We're seeing a lot of denials for patients who are admitted for psychiatric admissions, anxiety, depression, cancer patients being denied very expensive chemo medications. If they say, oh, you've got 20% progressive disease. Well, that chemotherapy was working because the tumors were growing slower. Those patients are being denied those medications and they are dying because they weren't allowed to stay on it. Wow. Even though it slowed the tumor growth down. My brother-in-law was one of those people. He died.
Whoa.
Because his insurance company wouldn't refill the it was a JAK2 inhibitor to treat melanoma.
Wow. So sorry. Yeah, things like that should not happen. So we need to have a discussion with Congress, and I'm happy to help, to give my input from my perspective on how we can all come together and fix these problems. Look, there's answers to these, and we could find a solution. This is a beautiful country full of amazing, smart people. We're brilliant people. We can all figure out a solution. We can do it. I think we just need to put this energy in and make it so that this is a priority.
Right. That's it. I mean, there has to be a solution. There's absolutely a solution. It's who's gonna take the energy and their time and the commitment, dedication, because it's all of those things. Because This is a machine. The medical industry, the money, it's a machine, and it's gonna take a lot.
It's getting in front of the right people too, Holly. I've been trying to get an appointment since Trump was in office with the White House to present some of the medical cases that I've worked with. Wow. My brother-in-law is one of them. Wow. How long is that now? We're into the next administration. I think I've got enough to say that somebody should give me a half-hour meeting, face-to-face with somebody in that position, somebody to listen.
Why don't you type your email on the screen here? I can see what I can do to help.
It's shocking. I mean, Gail, some of the I had no idea.
It's what I do every single day, Holly. 7 days a week.
I couldn't.
A lot of patients can't pay.
Yeah,
I couldn't help Chris's friend. Their stuff was too far along, towards litigation and collection and that kind of thing. I couldn't help them. Yeah. You've got about 6 months from the time you're hospitalized or you get a medical bill to do something to resolve it, to put a payment plan in place.
Wow.
People don't know all hospitals have endowment funds. And, it's getting in touch with the right person at that hospital to see if you can get access to that endowment. People need to tell their story. And people are embarrassed to say, oh, my God, I was earning $100,000 a year. I just had surgery and now we're financially struggling. We're behind on the mortgage. We're having trouble paying groceries. Can't pay for medication. This was my brother-in-law. I paid his medicine. It was $6,800 for this chemo medication. I paid it 1 month. He paid it the next month. Well, he didn't have much money left for my sister to live on when he passed away. He knew he was dying. And so I called the insurance company. Well, after about 3 calls of talking to me, they approved that script. But it was too late. He had already been sent to hospice. But he is just one example of what's going on in our healthcare system. And if we don't have doctors like Dr. Kaloostian on board, I'm a nurse. Somebody would rather listen to a doctor than a nurse, even though I'm face-to-face with patients.
Right.
It depends on how many I may work with in a day. I may work with 10 families in a day. I had to fight to get a COVID vaccine and couldn't get one in Georgia until they were available to the general public, my age category, the end of March. Even though I was seeing patients, making home visits all during the pandemic.
Wow.
I didn't yank my license out and go, oh, I'm a nurse, and go run down. I didn't say I'm an essential healthcare worker because I don't work in a hospital, but I do make a lot of home visits, especially on the weekends. So we've got a problem in the system, Dr. Kaloostian. And if we can't get in front of the right people to tell these stories, to lend their ears, it's like this COVID vaccine. They've got to start doing some door-to-door out in these rural communities. Yeah. All of these FEMA trailers they've sent out west, people don't have transportation to get to them. Poor people in Cancer Alley down, outside of New Orleans to Baton Rouge, they don't all have cars. They don't even have internet. So they don't even know there's a FEMA trailer there.
And, when I lived in New Mexico in Albuquerque, you can imagine there's so much culture out there, so many different Native American tribes living in reservations, believe it or not. I mean, and it's poverty. It really is poverty. And they have a lot of medical problems, especially alcohol abuse and other problems rampant in that area. And I took care of thousands and thousands of patients in that community, but most of them would come in so late because they didn't have any means of coming to the hospital. They'd come in when one eye was blind, when both eyes are blind, not when they were, paralyzed in one leg, but when both legs are paralyzed. It was like the latest stages of everything. And it's just such a shame and so sad because these could all have been really cured, treated without deficits.
So it's getting the message out there. That's why Chris and I do this podcast every week. We have a message, and we won't stop. I won't personally stop until I get in front of the right people.
Yeah.
Right.
To tell these people, for them to hear some of the stories of the suffering. You can't tell me Joe Biden wouldn't be sympathetic if he heard the story of my brother-in-law that worked his whole life.
Right.
You got
my head going. I know people. No.
Here you go, Holly.
And how many more lives could be saved? He could have lived another 6 months.
You don't even know. I my head is going because I didn't know all of this.
Oh, we're going to have you back next week, Holly. You didn't know that yet either. Dr. Kaloostian, tell the audience how they can reach you. We've got 2 minutes left.
Check out my work on Dr. Paul Writing. It's drpaulwriting.com. Hope you enjoy it. Look forward to our next chats.
Thank you. Holly, how can folks reach you? Because I know somebody's got some questions for you.
Let me get. I'm all red now. HollyRiddle.com or loveismyintention.com. The fragrance, which is very much more about how it alters our state of being, is 0.2.com. So I'm on this mission with you both, Gail and Christina, and Dr. Kaloostian. I do anything for anyone at any time they needed help, and
because it's the right thing. It's the right thing to do.
Because it is the right thing.
And we've got people suffering that have worked their whole life, and they end up dying because they need to go to a dementia care center, and they're on Medicare, and Medicare won't send them. They get a little bit combative. They drug them up, and they lay there until they die, tied to a bed. I'm seeing this in the state of Georgia, out in the county facilities. This is not a lie. It is real life, and it's happening every single day in somebody's family. Yeah. And it's people like me that get these calls. I've probably got 20 calls to return that came in while I've been traveling the last 2 days. And most of the families can't pay. I don't ask them for any money. If they're like, I call Christina. I've got a general in the Army that helps me send out Army advocates. So Dr. Kaloostian, we're on a mission, and we're on the same one you are, and you didn't even know it.
Let's get it done.
Right.
Let's get it
done.
There you go.
I'm ready. Let's go,
thanks, everybody. We're glad you joined us. Next week on Healthcare 911, my friends will be back, and we got a special show for you next week. Bye, y'all, and thank God it's Friday. Happy July 4th, everybody.
Thank you, Doctor.
Yeah.
Thank you.
Thanks, Dr. Kaloostian.
Thanks, Holly.